Computer.
Okay, so we are gonna have a little chat today to whoever is listening or watching this. Uh, this is December 15th, 2025 when we're filming this. We're not quite sure, I think, when this is going to be out, but very excited to kind of have this conversation and put something out. We'll do a bit of an intro. I'm going to share who I am. Um, and then we'll get to know each other a little bit deeper in terms of our practice a little bit later on. So if you're listening and watching this, we'll get more into detail later on. But for now, I can maybe introduce myself. I'm Danica Kaplan, the owner of Kaplan Psychotherapy and Wellness. I'm an RN psychotherapist and registered psychotherapist qualifying Ontario in Canada. I started with bedside nursing and then started on orthopedic surgery, which is quite a shift from what we'll be kind of talking about today, a little bit actually. And then I switched and pivoted to mental health. And then since then, worked a little bit in acute inpatient psychiatry, did some community counseling work at a women's health clinic, and then found psychotherapy in 2020, 2021, started the independent practice. And since then, been absolutely loving the work of psychotherapy and my own personal journey as well. And it was earlier this year that me and Tony cross paths. And so, Tony, you could maybe give a little intro to yourself as well.
Sure. Yeah. So my name is Dr. Tony Sandorfi. I am a um, neuroadaptive chiropractor, I would call myself, um, because my focus is on the nervous system and how I guess I would say that I specialize in helping to remove obstructions in the nervous system so that it can work better. And the body and the person can heal. And I've been doing that for almost 30 years. That's crazy to look back on all that time. Lots of experience, but I'm looking forward to exploring this with you, Danica. And partly, some people might be watching or listening and saying, well, what is a chiropractor doing talking about, aspects of mental health or that sort of thing? And I would say that it's even though I've always been interested in psychology, like that was one of the focuses in my early university classes way back when. Um, and I've always been interested in the body and mind. Um, but I would say that I uh, discovered that by working with the nervous system, there's all kinds of changes that happen for people, not just
Mhm.
physical. So, so we'll leave it. I think we'll leave it at that for now. We'll come back to that
Yeah,
probably, eh?
yeah,
Yeah.
we will. We kind of weave in and out, and I think that's why we're very excited to kind of combine. And since we keep cross paths, I think we've had many kind of meetings and conversations, and
Hmm.
how maybe conventionally, let's say, yes, in your work, people might not see how integrated is the nervous system and the mind and body is, and then maybe on my side, maybe conventional kind of maybe more top down approaches. Maybe it's just kind of about the cognitive, but there's actually a lot of body based work as
Mm.
well. So, kind of maybe bringing together maybe the fact that mind and body intertwine so much in our work together. But we'll talk about that a little bit later, more in detail. But
Hmm.
it's also if people see me kind of looking off, I have a couple little things I want to make sure that we don't forget and touching on. But it was really important for us to kind of establish why are we recording this? Why are we what's the purpose? What's the point of this? Because without maybe a goal and purpose, it can feel maybe kind of um, I don't know, maybe a little bit lost. So
Hmm.
we felt that it was the purpose is really about exploring and showcasing how trauma can show up in the mind and body and to provide hope, hopefully. We want to provide, our insights and experience on how to help our nervous system help find safety and feeling okay in our body when we might feel um, trauma in the moment, or maybe past being activated, and finding those activating factors, those responses, how to make them or how we might be able to help them feel more manageable, build awareness around those responses, and maybe some interventions as well that might feel helpful to somebody listening. So, if anything I just listed, you're listening and you're saying that seems interesting to me, then you are the person that we made this for, and hopefully that this is helpful. And then we'll be discussing or exploring three kind of main topics. We took some time too to kind of see, okay, what questions or what conversations might be helpful. So one we'll explore what is trauma, just kind of explaining, getting to that. How do we see trauma showing up in each of our work? And then can I heal from trauma? What do we do in our work to help with it? Um, and so before we kind of dive right into those, of course, we need to say some disclaimers and kind of just some info that this, if you're listening to this, by no means are we trying to diagnose. If you might maybe resonate with things that we say, but it's for maybe educational purposes only, not a substitute for, let's say, if you wanted to go seek kind of medical attention or diagnoses yourself. It can also bring up symptoms that might be uncomfortable maybe when you're listening to this. Maybe there's some unpleasant or unwanted, if you will, triggering kind of emotions, or sensations. If you're experiencing that, you're always welcome to pause this and come back. Or if you feel like it's just not the time for you, you're welcome to come back to this in general. But we do want to say that having these conversations, just be mindful of that it can activate some things for you. Um, we're also hoping that this can possibly validate your experience, and that in the discomfort, there can also be healing that happens. So we're really, really aiming for that. Um, Tony, did I miss anything, or do you have any comments before we
No,
kind of dive
no,
in?
no, I think that's great. That's a really good
Okay,
summary. Yeah.
okay, so let's get right into it. Our first question, like, what is trauma? Maybe do you want to kick us off with like the conversations we've been having on how we kind of see it and
hmm
what is trauma?
hmm Yeah, so from my or in my world, I would say that trauma is the afterglow or the echo of an experience that we have where in that moment, in that experience, we do not have maybe enough energy, enough perspective, enough information, enough safety, and like we're lacking in that moment as we're experiencing something. Um, and in that, because we're lacking, we do not fully integrate the experience. And so we kind of, our nervous system takes it on, kind of like puts it on the back burner and says, okay, we'll get to that one of these days, maybe tomorrow or the next day, or, when we can really address it. Um, and then it just kind of stays there, echoing through the various years that it might be there. Um, I like to think of it as um, back in the day, we used to have flash cameras, and the light of the flash would go off. And if you were looking at the camera, then after the picture was taken, you would still see the redness of the light in your vision in the somewhere out there, wherever the camera was, for, maybe just a few seconds, right? But that's kind of what trauma is to me, is that it's like the echo of the experience, where we're still perceiving it, we're still acting from it, it's still kind of controlling us, um, and our choices and perceptions.
Mm-hmm. I love the camera flash analogy because I think for people listening and watching, there's like this really kind of relatable visual experience
Mm,
in terms of the kind of those after effects of we feel, and even we like look somewhere else, and
hmm
then we are still feeling the effects of that flash.
hmm
Yeah,
Yeah.
absolutely. And using that analogy and that visualization, I think is helpful too, because when we talk about trauma as well, on like what it is and the definition, I mean, we could go to the we've spoken about the DSM, like the
Hmm.
Diagnostic Statistical
Hmm.
Statistical Manual of the definition, and I pulled up a previous definition in one of our chats, and where it says exposure to actual or threatened death, serious injury, or sexual violence in one or more ways, and that's from the DSM in 2013, so a little bit outdated, but um, I think the language and the vocabulary around it can maybe it can be difficult, let's say, for somebody maybe asking the questions of themselves, like, did I experience trauma? Does that align with something that I feel? I feel maybe lasting impacts of something, but it doesn't really fall into that category. And so, I mean, that's why I'm also really excited that we're doing this, because we can maybe provide also some other conversations on what trauma can look like besides maybe the um, more stereotypical experiences, let's say of PTSD, like a war veteran
Hmm.
comes back.
Hmm.
Um, some people might, I've heard in my own practice people saying, well, my experience isn't that, so I don't think it's trauma. Um, and so regardless of the DSM or whichever, my own definition that I sometimes talk about with clients is an event or events that have occurred, um, and it's had lasting impacts psychologically, spiritually, physically, etc. So there's an event that's happened in the past, and we are still experiencing it today as if it's still happening, despite the time that's elapsed.
Hmm.
Um, that's kind of the what I kind of conceptualize with clients, and I feel yeah, it leaves more bandwidth for people to maybe feel validated in their experience as well.
Yeah, and we were talking earlier about um, you just mentioned that, people aren't sure that you could they could call what they experienced trauma, right? People might not identify trauma as trauma, partly because they're they have experienced trauma, right? Like if you when you've experienced trauma, you tend to, on some level, maybe not consciously, but subconsciously, you are turning down your sensitivity, your emotional expression, your it's like you shrink rather than expand, and in that you might not feel like, you might say, oh, that was nothing, that was, whatever, it wasn't trauma, because maybe in their minds they think that, oh, trauma is like, you got to be like completely you know non-functional, or something like that,
Mm-hmm.
to have trauma, right? Whereas I think what we're talking about is that there's a gray scale. There's a black and white, obviously, but there's also lots of gray in between. Different levels of trauma, I guess you could say.
Mm-hmm. Yeah, and I think that's a really great maybe transition into like a segue into like that second kind of conversation we wanted to have, which was how do we see trauma showing up in our work, like the
Mm,
underlying mechanisms of trauma,
mm,
and maybe not as maybe overt ways that we see it.
mm-hmm, mm-hmm. Yeah, so how would you say that you see trauma in others? Or how do you
Yeah,
hear it, or
yeah. So yeah, I kind of conceptualize it in different ways. But I mean, maybe using language for like whoever, let's say listening and watching this, we might have heard of like the fight, flight, freeze in the nervous system. So I kind of like to use some of that language so it can be, as relatable and understandable as possible. Um, Symptoms that I notice likely indicate some trauma that has been experienced are kind of like on two different um, spectrums of overwhelm. And actually, maybe I can back up a little bit. Let's say in a session with somebody, in the first session, I might kind of go over something called the window of tolerance, which we kind of even touched on in like the disclaimer section before, where in the square, I usually say in the square of the window of tolerance, because I think of a window like a square.
Hmm.
We're in it, we feel safe and comfortable. Sometimes we have our arm or our leg sticking out of the square. We feel some discomfort, but the majority of us is still in the square. So we feel rooted in that comfort and safety still. But there are some times where we are completely outside of the square. We're not just uncomfortable or there's discomfort where we are completely in overwhelm. And sometimes in my mind, I understand it as kind of like high arousal or low arousal overwhelm. The high arousal maybe sometimes we might stereotypically understand as maybe, um, or maybe not stereotypically, but maybe subtly, because maybe we've experienced it as panic. Maybe our heart's racing. It feels like we're having an actual heart attack. Maybe there's yelling and screaming, whether it's us or somebody else.
Hmm.
Um, Maybe there's that anxiety or anger. So that would be maybe the high arousal kind of overwhelm. And then the low arousal overwhelm, where I kind of think about it, is there's typically like the numbness and dissociation. So somebody, let's say might be feeling overwhelmed, but when we ask them, like, how are you feeling? And they're like, I don't feel anything. When they've
Hmm.
just, let's say, described something that was really potentially traumatic. So, um, yeah, those are some kind of some concepts that I see, um, that trauma showing up, or kind of how I conceptualize it.
And would you include in that, or how would you integrate bandwidth into that? Because I'm thinking that, some people who the saying, who are at the end of their rope, right? Um, the the bandwidth is full and they can't take any more, right? Like they might be experiencing daily stresses, I don't know, at work or at home or car trouble or, things are, it's been a bad week or whatever. And they find that they're more likely to go into one of those two, like high arousal or low arousal places. They just want to like curl up into a ball and, you know, go into darkness, or they want
Mm-hmm.
to, or they're finding that they're being set off really easily by little things and shouting or yeah, being defensive or does that kind of come into it at all in terms of the window?
Mm. Yeah, yeah, like that. And it can be
Mm.
maybe subjective as well. Like, let's say I'm just using an example of, let's say somebody's baseline when they're angry is to yell or scream or throw things. Somebody, let's say, who sees that all the time, and then they see that, they might not be really phased. They might not feel overwhelmed in the moment because they're like, that's normal to me.
Hmm.
Um, Whether or not they might know they feel overwhelmed, that might be something else. But there's also maybe somebody, when we're talking about the window of tolerance, typically when there's engagement in an emotion, at least from what I see, I'm like, okay, we can work with that overwhelm. Like, you might be outside of your window of tolerance where I feel a lot of these emotions. Maybe there's the context of trauma in there, maybe not. Um, but it's really with the window of tolerance when I notice that dissociation and numbness,
Mm.
that disconnect, even maybe you've seen as well, where somebody might not seem kind of fully engaged, or they're describing something really traumatic or really distressing, and they kind of have this stoic expression. Or when we check in, there's again that kind of, I feel fine.
Hmm.
That's when that might kind of put the thoughts in my head of this might take more time, because we're not even feeling things anymore. We kind of need to move into a state where we're back to feeling, and
Yeah.
then move to back into the window of tolerance.
Yeah.
Yeah.
Yeah, absolutely. Absolutely.
Yeah, have you seen that too? Or I'm wondering what versions of
Yeah, I
maybe
would.
there's something different, like the terminology of window of
Mm.
tolerance in your work.
No, that's window of tolerance. Could that be? considered the comfort zone,
Hmm.
kind of.
I think so. Yeah.
Yeah, yeah. Because when I'm working with people, because I'm a chiropractor, people come oftentimes, unless they're referred by somebody who's already been, they come because you go see a chiropractor for sciatica, you go see a chiropractor for low back pain, you go see, there's various things that you go see a chiropractor for, typically, generically.
Hmm.
Um, but oftentimes, and it's not very often that people see the connection between the two, but when they start to have the symptoms of sciatica or low back pain or headaches or what have you, it's actually their body telling them that their window of tolerance or their bandwidth is full
Mm,
and their window of tolerance is constrained, um, and can't take much more. Um,
mm,
and um, and so I would put it that way that um, when I'm working with someone, I'm not only helped wanting to help. Obviously, we don't want people in pain, but if they can learn why the pain is there in terms of this window of tolerance and maybe their body is actually saying, you know, we've been living in this comfort zone and just the way that life is right now, this is all we can do. And the body can't keep carrying the way it has been anymore. So you get pelvic issues, you get, low back, headaches, whatever.
hmm. Yeah. Yeah. Those symptoms of like, this is maybe a sign that my, like, something is trying to communicate to me that I might feel like this is pushing my baseline. I'm
Hmm.
or no longer at my baseline anymore.
Hmm.
Um, yeah. And I like the way you were saying that it's like the notion of like it's trying to tell us something. Um, because I find I hear maybe a lot of, and maybe in your work as well, of like, um, how do I get rid of this? Or maybe there's kind of taking maybe medication on a consistent basis to kind of help with the symptoms,
Hmm.
whereas like the original kind of pain, if we're kind of, let's say we're it's giving us data. And I find I see that, at least in my work, a little bit, where let's say somebody might come into the office and say, how do I get rid of this panic? How do I get rid of this anxiety? How do I get rid of this anger? um, and it's really understandable because it can feel really uncomfortable and really painful. um, but I think the second we start to kind of try and push things down, and I've said this um, with clients as well, when we try to kind of push things down, we're kind of no longer in communication with what our body might be telling us, like
Hmm.
what our needs are. If we get angry at something, typically it means something feels threatened, something maybe has felt taken from me. If we're sad about something, that's telling us, something's really important to me. Yeah. So I think like this whole notion of kind of listening versus trying to eliminate, because if
hmm
we're listening, it can give us insight as to what we need, and maybe changes that need to be made, or
hmm
like let's say time off even,
hmm
for example.
Yeah, yeah, exactly, exactly. Um, and over the years, people have asked me like, so because chiropractors in general are, excuse me, they are, focused on natural health care. We're not, allowed to prescribe medication, for example. But neither would we necessarily. We would maybe find more natural means of pain relief or
Mm,
mobilization or what have you. Um, but that doesn't mean that drugs are bad or surgery is wrong or I talk to patients about this all the time because it depends on how long you've been living this way, like with that. window of tolerance being too, like too much outside of the window of tolerance, I would say, using your example of, a foot over here, an arm over there, what have you. Um, because from what I've seen over the years is that the body can carry a lot until it can't anymore. And then sometimes people do need medication, or people do need surgery, or people do need some, more of a the intervention needs to be something, big, and sudden. But like to your point about um, that kind of intervention has become the go-to instead of first listening.
Mm,
Like people will want to opt for, not everybody, but some people will want to opt for surgery if they notice that if they go get scanned and they have an MRI, and the MRI shows that they have a disc bulge and what have you, they might choose to go have surgery for that without considering the greater context of why is the body in pain? Why is the body experiencing this instability? Um, and like how it developed, because it doesn't happen overnight usually, unless it's a super severe accident of some kind.
mm,
Um, so yeah, so the approaches in healthcare from a physical medical perspective are typically there to stop the messages from coming through, which is really antithetical to what we're talking about, right? Like
hmm
we want to help people listen to their bodies more because there's wisdom there that's coming through,
hmm
right? There's
Yeah.
data, there's information.
Yeah, absolutely. I think it's important for the people listening and or watching, like when you're saying like there's nothing wrong with it, that if you want to get some kind of intervention
Hmm.
done,
Hmm.
in that I think the importance being like what you're saying to maybe take a moment to take stock of maybe what's happening or what brought me here,
Hmm.
and maybe prevention, even like let's say if okay, this intervention is going to help me in this moment, um there's some patterning there that maybe is worthwhile to kind of explore and address.
Hmm. Hmm.
Yeah.
And I think that patterning is related to the trauma for
Yeah.
some people more so than others.
hmm yeah, and I wonder too, because we can maybe talk about we also want to talk about the third kind of question we were saying is like, can I heal from trauma? And what do we do in our work to help with trauma? Like when
Hmm.
you're talking about like the interventions, let's say. Um, yeah, I'm curious, maybe building on what you were talking about, let's say there's the person who had like this patterning of kind of over time, the bulging disc, and they're maybe given the two options of, okay, do you want the surgery, this kind of big intervention, or do you want something else? There's another option. Let's say with the work that you do, or can I heal from that trauma? What would that look like for the person who's saying, I want to explore this other option with
Yeah,
you?
it's more so the radical, what I would call a radical intervention, where you cut something out, or you take a medication, or something to stop the discomfort, or to correct the apparent imbalance in the lumbar spine, let's say in the low back with a disc problem. That it's an event, right? It's a cure. Well, that's the problem there. Let's get rid of it. Okay. Whereas the other approach is uh, more what we would call a healing journey. Okay.
Mm,
Where where you help a patient find To move from instability, whether that be physical, emotional, or mental instability, to a place of stability and a feeling of safety and a feeling of, well, at least right now, if I generally move my body, I don't feel the pain so much. And then once they find that more stable level ground, then we can start to work with maybe expanding, growing the comfort zone,
Mhm.
um, stretching it in different ways, um, to allow them to feel even more capable of handling whatever there is to handle. Um, there's another part to that question that because you asked what is that other option,
Mhm.
right? So it's and I called it the healing process or the healing journey.
Mhm.
And it basically involves rather than eliminating the messenger, whatever that messenger is,
Mhm.
whether it's pain or distress or emotional upset or anxiety or that sort of thing. Living with it and not just living with it, not like accepting it, saying, "Oh, I'm going to have this for the rest of my life," but to use it to explore oneself and to get to learn the different layers, I guess, that we have. Because from my understanding of trauma, when we experience a trauma, whether it's usually, earlier on in our childhood, it doesn't have to be. It can be any time we can experience trauma. But when we do experience it early in our lives and we don't fully heal and integrate that experience, then it's like we're trying to live life with one hand tied behind our back.
Mhm.
And we're trying to do everything that we're supposed to do in our lives, but without one hand. So we learn to compensate. We learn to compensate in our relationships. We learn to compensate in our emotions, our physicality, um, and in my mind, these are the patterns, the compensatory patterns that we start to discover when we start to listen.
Mhm. Yeah, and maybe those somebody might come to you and maybe let's say they've been maybe compensating for so long that it's maybe their baseline. And
There,
so it's
it's
almost about like retracing the steps.
yeah, absolutely, absolutely. And I
Mm,
think too that, and maybe you could say more about this. If you do something long enough, then it becomes a part of you and it becomes a part of your identity and it's how you see yourself. Like, oh, I'm a worrier or I'm anxious or I'm this, I'm that, I do that. This is how I am. And it's that in itself is an adaptation to living with the trauma.
mm, hmm. Yeah. Yeah, where it's like it's kind of become maybe enmeshed in how we perceive ourselves. And so it can, once we get to that point, it can be really challenging to even think of anything else. Like,
Mm,
of course, I'm always going to feel anxious, or of course, I'm always like, it seems like it's almost this kind of, it can feel like a life sentence sometimes.
hmm hmm
Yeah.
Or it might even, I've heard some people say things like, well, I'm this way, and my mother was this way, and her mother was this way, whatever it might be, depression, anxiety, angry, like whatever it is. Um, And maybe and how do you feel about this? Maybe I'd like you to comment on this. So sometimes what I've observed with some people is that the trauma that they are living with is not even theirs.
Mhm.
Like maybe something happened in your mom's life or dad's life or in your grandparents' life or and their way of adapting and their way of compensating was what you learned as a kid in terms of behavior or relationships or whatever. What do you think about that?
Hmm. Yeah, as maybe you were talking, I was um envisioning the example of somebody who, let's say, grew up in a household where conflict became turbulent, where let's say there was one parental figure who, when they were angry, everybody knew.
Yes.
There's yelling, there's screaming, and I think of maybe the child growing up in that environment who, let's say, comes and says, I want to work on my anger. I get
Hmm.
so angry. And then
Hmm.
as we peel back the layers, we find out it's maybe that was the acceptable way or the way that was modeled as to that's how we go with anger
Right,
in
right.
terms of when we're talking about, let's say, trauma. But I also envision the other way where we have maybe the client coming in who, whenever conflict comes up, whenever turbulation comes up, even maybe even the slightest kind of raising of voice, or maybe someone even looking remotely physically imposing, they immediately withdraw or
Mm,
they immediately shut down.
hmm.
And that could look like we maybe don't show up to the plans we said we were going to because we found out somebody else was going there. And it could be very subtle, those examples, but somebody who has then adapted a different way, let's say from certain traumas where that feels so activating.
Right.
I That's how I have learned to survive and cope or compensated or with that analogy. Yeah. I'm not sure that answered that question.
I think so. Yeah. Yeah, yeah. Yeah.
Yeah.
Yeah. Yeah.
Yeah.
So like in other words, I think what I was going towards with that thought was the trauma doesn't have to be specifically from something that happened to you. It could
Mm,
be that, like you said, you could be raised in an environment that the traumatic, that you had a traumatic reaction to, somebody who was like raging or, and it could be the reaction could be that that's how you've learned to do it, or it could be a different kind of compensation where you withdraw and you shut down and go inside yourself more or what have you.
hmm.
Yeah.
Right. Yeah. Yeah. Like you might not even be the person who is, let's say, like you could be the one receiving of, or the person who was in that perspective and that POV. Um, I think of even, let's say, with this example with, let's say, a friend of child at that time came over to hang out, and the one parent, let's say, being explosive, that friend leaves, although they, let's say, didn't grow up in that family, they might have now kind of had some kind of impact in that. So even though you're kind of the friend adjacent, you still might be experiencing that. All that to say, I think, and what we're maybe kind of saying is that like there's so many ways that it can be experienced,
Yeah.
um, and kind of taken in as we go along.
Hmm. Hmm. Yeah. And so how do you, what's the question I want to ask you? So we've taken that in, whether it was direct or indirect or what have you.
Mm-hmm.
We're it's funny because even the words that we use, right? We take it in. as if we're like eating something or, but it's, we're taking it into our bodies, right?
Hmm.
Because we
Hmm.
experience our life through our bodies a lot, right? Like, hopefully, hopefully. Um, and so how do you help someone who's done that?
Mm. Who's kind of been in any of those positions?
Hmm. Hmm.
Yeah. Yeah. Um, so one of my, like in the psychotherapy field, there's like different modalities. I use a few, one of them being somatic experiencing developed by Peter Levine. I won't go too into the kind of depth with that. That could be for whoever's listening or watching. If you're not already familiar with that, it's a great kind of modality to kind of research. But my understanding of it, or how I've kind of interpreted it, is somatic, meaning like how we experience things in the body. Um, and I use this example all the time where, let's say, somebody who is highly anxious, or when we feel anxious, highly anxious, we might be thinking, oh, what are they thinking? Or what if this happens? What am I going to do if this happens? At the same time, our heart is racing. Maybe we feel a pit in our stomach. Maybe our hands are sweaty. Maybe, maybe we start to feel numb. Um, so there's that kind of experience um, that we maybe conventionally think of the thoughts when we're in the thoughts, and meanwhile there's actually this internal experience of where the trauma is kind of kept. um, because like you said, we can kind of the trauma, or at least my definition of it, is an event or events that have occurred, and we are responding in today as if we're still back when that event or events were happening. So that's what it's coming up in the moment. So I use somatic experiencing a lot with clients, and there will be definitely sometimes with clients where we might slow down in the moment in the session, and I say, I'm going to ask the strange question: what are you noticing in your body? What's coming up? What sensations? And for people who have maybe cognitively processed for a very long time, meaning maybe we're kind of in that cognitive of what's going to happen, what am I going to do? I want to figure out why. It's like I want to figure out the why. Um, that can feel very disorienting, even frustrating.
Hmm.
And I get that in sessions when I ask that question. Some people might be like, "Why are you asking me that?" Well, what, like I'm not feeling anything, or I'm just sitting, I'm fine, or I'm relaxed. But there's when we kind of slow it down, um, that's when kind of we are giving ourselves permission to feel
Hmm.
those things, like actually truly feel at like the elemental level.
Hmm.
Maybe when we slow down, we start to feel that when we connect with that heaviness in our chest. um Sometimes people say like I'm starting to feel like I'm about to cry. And it's interesting because it was the second where we're not talking about the thing that happened anymore. We're just connecting with how we've experienced it. And it can feel very validating to kind of know that that experience is happening inside, and we're paying attention to it. We're listening. I pull also from internal family systems as well, and that could be maybe integrated. But there's that part of us that felt frozen in that time, that has we're in our current self is kind of almost kind of going into the room and sitting next to that person, putting their arm around them and saying, I'm here, I'm listening. That must have been so hard for you, or
Hmm.
whatever that kind of process needs to be.
Hmm.
Um, yeah. But that also takes pacing. The whole thing is kind of pacing in terms of somebody who, let's say in that example, has cognitively processed. It needs to be kind of experienced in very small doses in terms of what do you notice in your body. Because for somebody, let's say, who starts to feel that, they might leave the room, and then what do I do with everything that's now been brought up? So
Hmm.
we want to make sure that people are kind of adequately resourced, coping skills, interventions, etc.
Hmm.
That's also valid and important as well.
Wow, that was great. Thank you.
Yeah,
And what is what I especially like about it is that I could just say ditto pretty much for
yeah,
everything you
yeah.
said.
I think it would be really great for the people listening, and I always love having these conversations with you, Tony, of like where like I'm sure you see that so much as well. So I'm
Hmm.
curious too,
Hmm.
like in your work too, like maybe elements of that where you just see that as well on your end.
Oh, absolutely. In fact, I'm asking patients, so it's a very different kind of approach. It's not, the chiropractic visit is not for, to move some bones or take pressure off nerves necessarily like traditional or conventional chiropractors do, or to restore joint motion. Um, that all happens as a result of what we do, but it's not the goal. And the
Mm,
goal is really um, to change how the nervous system is working. So typically, when someone comes in, and whether it's about trauma or whether it's not, let's just because this talk is about trauma, let's I'll stick with that. Um, their nervous system will typically be in a heightened state of arousal, like more sympathetic nervous system, more fight or flight,
hmm
or a freeze. Um, and my goal during the session, my goal is to help them find a, a completely opposite feeling. So if you've ever had, um, have you ever had a sensation of, maybe you're stressed, worried, tense, um, feeling somewhat upset, and somebody comes and just puts their hand on your shoulder and says it's going to be okay, and
mm,
you feel your body going,
mm,
ah, right, and
hmm
you can breathe, and so that's what I'm looking for to do in with the person's nervous system. And so I use a very gentle touch along the neck and the tailbone areas mostly to uh, elicit that kind of response. And when the person is able to take a breath, to relax, to feel their body relaxing, letting go, um, I encourage them also to watch themselves on the table as if they were watching a movie.
mm,
So observe yourself as you're lying there on the table and notice when you're cognitively processing, when you're thinking about your to-do list, bring yourself back to your body, bring yourself back to
mm,
that screen and watch. Because when we're able to switch out of that fight or flight, freeze reaction, we actually then become more resourceful. Because when we switch out of it, we are feeling more safe. We are feeling less in survival mode. Um, we are feeling that in this moment, I'm okay.
mm, hmm
And just that, the physiology of that, I don't think I'd even be able to describe all the hormonal changes that happen, the cell signaling that occurs in the body and the brain to to be in a different state. And when we're in that different state, it's like, okay, this is what life feels like without the effect of the trauma, without the compensation for the trauma, without the cognitive processing. Like we can just be. And and if we're observing ourselves, then we're able to start to connect the dots. We're able to listen better. We're able to stop trying to figure things out,
mm,
stop trying to problem solve, and we can just experience and allow things to happen. It's like, if you're, let's say you're cutting up some cardboard for recycling and you cut your hand by mistake, just you nick the skin a little bit and you bleed a little bit and you put a Band-Aid on it, your body heals. right? Like eventually you get a scar, eventually the new skin forms. It's the healing journey is like that. It's like if we can just allow, if we can just be, then healing happens. And we can watch it happen, we can participate with it. The very best thing is we can get out of its way to do it, to allow it to do what it needs to do. Um, I would say that there's that somatic experiencing. I know that's an officially, I don't know if it's probably trademarked, right? Um, the technique or the approach. But really, somatic experiencing translates into experiencing our bodies, in
Mm,
experiencing our sensations.
hmm hmm
However you do that, and when we are able to switch off that guarded survival, defensive mode, then we're able to feel more. And it helps obviously to have someone to, like you said, validate your experience, what you're feeling in your body, to um to let people know that that's normal. Like, like
hmm
for example, like if somebody says oh, I'm having heaviness in my chest, I feel like crying, then some people are helped by hearing, well, then it's okay. Here's some Kleenex or whatever, right? Like,
hmm
um and that's what I mean by letting the healing just happen. Like stuff comes up, you let it go.
hmm Yeah. And I'm curious, like there's so much, like you probably saw me nodding, and for people watching too, like nodding, like um I think we also kind of align on like how so much healing can come from the body, even that like break of like when you said that the hand on the shoulder, and then there's maybe that moment where we're like like that
Mm.
sigh of
Mhm.
relief, and
Mhm.
maybe when we've felt the experience and the symptoms and the after effects of trauma, and we almost get we might even feel that very brief moment where there's the absence of that hold it feels like it has on us.
Mhm.
And it can feel like that, like you said, that awareness. And we were talking about the baseline earlier, where, oh my gosh, like there's something else out there for me. There's something else that's possible
Mhm.
besides this kind of terror or panic or helplessness I've been feeling for so long.
Mhm. Mhm.
Um, and I'm curious too, let's say in your work, on that note of like the terror, the panic, what what do you say to people who are so scared, let's say, or very hesitant or apprehensive to start or to engage and take that maybe risk of maybe they're not used to it, or they don't know what's to come or if it's possible.
I don't know if there's anything that I can say in particular.
Mm,
It's not like I have a one-liner that works every time or something like that. It's not nothing
true.
like that. It's more um
Or something to reassure people who are wanting or curious, maybe.
just that I find it, I find that it's not so much like if I'm talking with somebody like with you, or like if I'm talking with someone during an online consultation or in person, it's more, I try to let them know through my presence with
Hmm
them that they, if they wish to engage with me in particular, or if they wish to take that next step, um, towards on that healing journey,
hmm
that I'm hoping that they will know, or that they will feel that they're not going to be alone doing it.
hmm
That and so maybe that's what I would say is that to someone that they don't have to do it alone. They won't be alone if they choose to take that step.
Mm,
Yeah.
I think that's a beautiful, well said thing.
Oh, cool. Thanks.
I think what I was even like maybe pulling from my own experience. I remember when way back I had my first chiropractic appointment. I was so nervous leading up.
Mhm,
Even the drive there, my heart was racing. A lot of anxiety of like, oh my gosh, what's going to happen? Um, and I think it's really powerful when you're saying that. Like, it's kind of like ultimately you are the empowered individual to make the choice if you want this for yourself. And if you so choose, I'm here to support you.
mhm,
I'm here to be there with you through the way. But yeah, there's, I guess, like you said, there's nothing necessarily that can be said because it's going to come from within. It's going to come from the person's choice, and even in our own personal kind of experiences as well. Any experience, it's like we are you maybe want to be in the driver's seat, the empowered individual, because then nobody's kind of deciding it for you. And I think it reminds me of in my work as well, when sometimes, let's say in a consultation, particularly, or something like that, but um, someone saying, "Is this going to help?" Or "Do you think you can help me?" Or "Is there hope?" And I think I noticed that actually maybe I kind of have a similar response of I don't know. I also have to say my bias that I always like to be hopeful, but at the end of the day, it's going to be your own kind of choice and drive and decision. And
mhm,
I'm happy to support you in
mhm,
that process. And I'm committed and here and present if
mhm.
you choose to take that step forward.
That's also beautifully said. The empowered individual, right? Like it
Mm-hmm.
is their, it is each of our choice, decision. Um, and I would say maybe that the empowering comes from when we decide to show up for ourselves, not for anybody else, not for the practitioner, not for, you know, just for yourself.
Mm-hmm.
Um, and when that happens, that's actually what the heal that's what makes it healing.
Mm-hmm. Yeah, absolutely. And it reminded me of so let's say anybody listening or watching this as well. I know sometimes I hear like I feel like I'm so
Hmm.
behind. Or let's say somebody, it's like, okay, I'm choosing to do this now. I wish I would have done this earlier. Like, well, when you're saying it's the healing journey, whenever we choose, it's in our own
Oh
timing
yeah.
of when we feel like that is the right step for us. And sometimes it's not linear. In fact, it's never linear. We are going to maybe whatever our healing journey looks like for each of us, we're going to be on it, and then it's going to take us down a different path. Or sometimes use the analogy of like the highway, or like we're on the journey together, we're on a road trip together. They're in the driver's seat, I'm kind of beside. We might think that we're putting, I don't know, whatever is in the GPS, a beach. But then, I kind of I'm hungry now. I want to get some snacks. Let's go off this highway, and then we get some snacks. And oh, look at this. All that to say, it's going to be different. And I think for those listening, I'm hoping that this is maybe kind of reassuring or providing that hope that like it is possible. You are the empowered, individual who, will make that decision when it's right for you, or take whatever steps that looks like in your own healing journey.
Hmm. Awesome. Yeah.
Yeah, I think we've covered maybe those three questions. And so maybe we can start to kind of wrap up and see if there's anything that you feel that maybe we missed, or something that somebody listening or um watching, any other maybe kind of things we might have missed, or tidbits, or last kind of words, or
Yeah. Well, there was something I was thinking of adding because um when we were talking about the healing response when we learn to allow ourselves to feel whatever needs to be felt in the moment without necessarily having to understand why. Like
Mhm.
if you feel sad, nothing in the surrounding environment is right now is making you feel sad, but you feel sad. So doesn't make sense, but let yourself feel it anyways, right?
Mhm.
Um, there comes a point, what I've observed too in the healing journey for many people is that the more they can do that for themselves, there's a momentum that starts to build where you're giving your body more and more permission to express, um, to let go, to integrate, to whatever, to change certain patterns of behavior, um, conditioning, um, and those um, patterns that we developed as a compensation. There's a momentum that starts to build where the body starts to actually do more. How would I put this? It's like, when you have when you if you feel like crying and you have a good cry and you just let it all out, right? Go through a Kleenex
Mhm.
box or two or whatever it is. Or you scream or like you're expressing some kind of energy, some kind of emotion, something compels you to do this. There's a point at which sometimes it doesn't have to be this way every time, but there might be a point that you experience where you feel like it's no longer you that's driving it, it's your body. And it's almost like when you're done with it, when your body finishes. It's like, do you know what I'm talking about?
Yeah. Well, it's kind of like when someone's like, "Oh, I'm scared if I let it out because I'm afraid it'll never stop." Let's say in the case if the letting it out was crying.
Hmm.
Typically I mean, if we start crying, it will stop eventually.
Hmm.
Or else maybe we'd be kind of our whole existence would just be like crying. But like it eventually runs its course. We
Yes.
kind of feel this kind of catharsis.
Thank
Yeah.
you. Yes, that's a great word. It's a catharsis. And it's at that point where we know that something is that we're different, right? It's like it's not that we just had a good cry. It's like, no, we're fundamentally different moving from this day forward. There's something different about us. It could be that we're no longer holding the experience in our bodies, at least not in the same way.
Hmm.
It could be that we've detached from some aspect of it, but something fundamental. Maybe we don't see ourselves the way we did yesterday. Maybe we don't see ourselves as an anxious person anymore, or a worrier, or those things that we start to identify ourselves with because it's been so long. It's been so long with us, right? But something fundamental changes, and that is possible. I think I wanted to add that in that it's not like maybe at the start of the healing process, the healing journey, it may feel like, well, this is just a way to manage my anxiety or my, whatever it is. But it is possible for it to also build momentum into something that takes you to a place that you've probably never even considered possible, right? Life
Hmm.
without the effect of the trauma. Or um, not, so maybe, yeah, not in. not with the life without the effect of the trauma, but also with the gifts of the trauma. Like we're able to look back and see how, something might have happened whenever, but we've learned from this. We've become different. We're a different person, and now we're going to choose to live our life differently.
Mm, yeah, the gift of trauma really struck me because I think maybe that, um, let's say someone hearing it might um, have some difficulty maybe thinking like, what could be good from it? But there's maybe kind of what I'm hearing you saying is that like it's this really rewarding experience and it gives back in terms of this kind of getting to know yourself, how things impact you,
Yeah.
uh, processing in a way that maybe feels freer or lighter or different in
Mhm.
whatever way that might be. And I think maybe sometimes we feel like, okay, maybe at the beginning or wherever at some point in that healing journey, it's like, okay, I'm gonna arrive at like a destination, let's say. But a lot of the time, at least um, in my experience from what I've seen personally, maybe professionally, is that the healing journey kind of is like you're walking into you open a door into a room and there's more doors, and then you open to that door and it kind of continues. It is kind of this kind of lifelong journey, but not in a way that feels limiting or constricting, but in this really kind of freeing way.
Because I think every door offers possibility. It's not just another door to go into another room. You don't know what's on the other side of that door. And when you open it, it's like you're opening up to what else is possible, as
Hmm.
opposed to just endless, endless room after room after room. Like, I'm never going to be done this. Oh my God.
Yes, yes, exactly.
Yeah.
Yeah, it could be a very empowering experience
hmm
in general.
hmm
Yeah. I love that kind of note of I think it can be um something that we can take from it in terms of this conversation on trauma and um maybe hopefully this kind of also contributes to that feeling of us the goal of kind of instilling maybe some kind of hope around the context of experiencing um or being a survivor of trauma. Like there's it's something that can be explored and in that kind of exploration, that journey, there could hopefully be some kind of integration, relief, etc.
hmm Absolutely. Absolutely.
Yeah.
Wonderful.
Yeah. I think that might be really a good place to end on.
hmm
Yeah. Okay. So for whoever is listening and watching this at the time, um, we're still TBD, hopefully to be, on each of our websites and um, we'll put, ways that wherever this is posted, ways that you can reach out to us, contact us if you have any questions on any of the topics that were, discussed or you want to get in contact. We'll make sure that information is somewhere in there. Um, and we hope that this recording served its purpose. And yeah, always a pleasure chatting, Tony.
Likewise, Danica. And maybe we'll have some more conversations in the future.
Maybe we'll have some other volumes
Yes.
for the people listening and watching.
Yes.
Yeah. All right. So we'll end here for today.
Thank you.
Okay. Thank you.